Good afternoon to everyone. You can see on the left side there's some snow. Everybody who is free to help me shovel my driveway in a few minutes, please do so. We have a nice snowstorm in Calgary at this moment. So I'm going to try to entertain you for the next 6, 7 minutes on the impact that this pandemic had on research and clinical care, and even on how to organize a virtual conference. Next slide. So basically, again, clinical care. I want to be clear. Every one of us has been somewhat affected by this pandemic on mental health, medical health, on our social interaction on a daily basis. This has changed our life. If somebody was said to me a year ago at the CADRA conference that we will be doing a virtual CADRA conference a year later, wow, this person was certainly having a crystal ball that I don't have. Next slide. So from a clinical care point of view, the statement on the left side, which is, I think everybody agree that this had a significant impact on the provision of medical services on these patients with ADHD. But I could say that this has been also true for anyone with developmental disorder, anyone with waiting for an important surgery, with cancer, etc. I know that ADHD population still remains a vulnerable group during the pandemic, but the bottom line is that my statement that you're going to see on the right side of this slide can apply to any type of patient. And overall, after reading a lot of paper, discussing with my colleague, you could see that for ADHD patient, it delays the follow-up appointment. It postpones new patient assessment. Probably there was a reduction in referral rate. School feedback is so important. Try to have school feedback when the schools are closed. Medication, some issue maybe by starting it. Follow-up was not optimal. The support given to these kids were sometimes not even present. Parents were also struggling. Let's be honest. Many of our patients with ADHD, parents will say, I'm also having ADHD or having other issue. And finally, if you try to do a physical examination on Zoom, or even try to do an IQ testing on Zoom, good luck. Next slide. That being said, what I'm going to present to you for 1 minute, this is absolutely non-scientific data. I was trying to organize teaching with some of my colleagues around Canada, and we're all within the developmental pediatric field. We said, how are you doing with your patient, etc. So I started to ask questions about ADHD. So I'm going to show you some comments. So I know there's a lot of things. You don't have to listen to what I'm saying. You can read stuff, but I think you will agree with many of these points. The first quote is basically, many of our families, so this is quote from doctors I received, lost any kind of routine. I think this is not surprising to all of you. For some family, depending on the provinces you were living in Canada, um, school was somewhat canceled. Cancellation means I don't have to do any more work. And the bottom line is that they promised me I'm going to have a baseline kind of mark. So I'm not going to be kind of failing. So why should I work? But there are some family, the third point, the two bullets, that were embracing homeschooling because that was giving them a chance to see how can I organize everything that I've learned to help my kids. So they made, for many of those, academic gains because the kids were not necessarily distracted and they put a lot of routine. I'm not saying this is quite common, but it's something that has been reported. But let's be honest, and I'm sure everybody is probably in agreement with me. Virtual schooling, there are many parents that are not doing well. I personally did over 70 hours of teaching with Zoom to medical students in over a 3 months period. I was not burned out. I was completely Zoom out. So I must say that these parents, they were struggling before, they were struggling after. The technology, I think, Tasmia told you a lot of hurdles. Next slide. Overall, for some parents, for some kids, this was quite beneficial. In fact, those with a lot of comorbidities did, for a lot of doctors, it says, you know what? We're so proud of them. They're doing even much better, to a point that parents were questioning, should we send back to school or should we continue homeschooling? Again, we mentioned losing support at school, screen time. Rose, you nailed it. I mean, it's just basically, it's so obvious that kids are, I mean, I increased my screen time. Okay, I'll be honest with you. Okay, but I kept going at bed at the same time. So I must say that I knew it was important for me to maintain good habits. The last point is about, I like this quote from one of my colleagues, Listen, they were up all night, unsupervised, sleeping during the day. Uh, as parents, we were struggling. I don't know whether or not they were eating, probably a bowl of cereals. They stopped eating meals with us. They were on games. They were sleeping in the middle of the day. They were working, playing in the middle of the night. Uh, and some of them stopped medication. And you saw the hurdles they had by continuing their medication or even having the prescription renewed. And Rose mentioned to you physical activities between you and I, especially if you live in Canada. March, April, and May, it's spring and winter, and gymnasiums are closed. There's no more soccer. There's no more opportunity for kids to do any sports. Next slide. Rose said it, but I took some of the qualitative kind of comments we got from our research study, and I showed it to my colleagues. Says, you know what? Parents are saying, help us. We need more psychological services. Access to you doctors was difficult. I could not even find where my psychologist anymore. The parent support group, nobody thought about organizing support group for parents, just for parents. It took a while because we were all stressed. Everybody on this planet felt the pressure. Things have changed. This was the first time in the history of this humankind that we stop everything. We sacrifice the economy based on a social decision to, probably save more human lives. That was the first time. Emotional child health relief. And the word, when I say respite to my colleagues, it says, you know what? I've never heard that word so many times since March. Next slide. Next slides, I'm sorry. So overall, I'm not surprising all of you by saying that there were reduced access to medical services. The fact that they were not able to get access to pharmacological or non-pharmacological treatments such as behavioral certainly had impact that were quite negative on these kids. But the true impact of these kind of features will need to be measured. And this is what I'm calling for all of the researchers listening to me. We need to do good research. I think everybody read some interesting paper, but between you and I, many paper published in April, May, and June, the quality was so-so, let's be honest. I'm not talking about the one in the Lancet, talking about the beauty of some treatment promoted by one leader in the world. I'm just telling you that would be important to really measure the impact that these kids suffer. Next slides. The bottom line from a research point of view, there's ups and downs. Maybe I should top with the ups. That will give everybody. Look at the numbers survey. I'm going to tell Rose and Tasmia, I was the first one to say, you know what? I'm predicting we're going to have only 100. And if this is not the case, I'll pay you a meal. I'm always losing my bet. I lost my bet here, 587. We were able to access to some remote families. Zoom was helping for some research. But, I took that time to write many papers, and I'm sure that all the researchers here had time to probably said, it's time for me to write stuff that I always put on the side, having those kind of this is a research paper. I'm supposed to write it one more time, in the next few days. Probably help for some of us to maintain a better work-life balance. And in Canada, there was a lot of opportunity for grants from the CIHR, lots of money. But on the right side of the column, you could read it with me. Zoom meaning when you want to do kind of it's not replacing the one-on-one. You cannot do an IQ testing. I'm sorry, but I don't believe into it. We were supposed to do a neuroimaging project, but no kid was allowed more than 40 minutes within the children's when they were coming here at our hospital. Team meeting. It's great to meet together. I know we're meeting by Zoom, but there's nothing like meeting face to face. There's a lot of you researchers, pressure. I need to perform. Where's my money? There's no more money. Funding is difficult. My salaries count on it. Plus the stress. I need to perform. There's other issue. I got kids. My kids are sick. What am I going to be doing, etc. And there's so many other issues, including anxiety from all of this. Next slide. Therefore, the lesson learned is that I think we're still within the, call it the second wave. We're still into it for many months to come. So we need to find a way to identify these kids that are with ADHD that are struggling. We need to find better way to support them. We need to make sure that they're continuing to implement their strategy we're trying to teach them. We cannot put the blame on the pandemics. We need to be creative. The telehealth is there for many years to come, probably forever. How can we optimize its use for these ADHD patients? Maybe this will give us a way to an opportunity to find more ways to help children and adolescents with ADHD, and not necessarily. Um, it's my wife who was just calling me. I'll call her later. Maybe this is providing an opportunity to do more collaboration, more protocol, um, and our protocol needs to be more flexible. And well, that's it. Next slide, and I'm almost finished. You know what? Thanks and kudos to the cadre